Many people experience foot issues in their life. A twisted ankle, ingrown toenail, blisters. There are plenty of ailments that can have you hobbling around for a spell, but if you are diabetic, those same ailments can turn into serious situations that can not only sideline you, but put your feet in jeopardy. Well, I recently visited Dr. Kevin Thomas of Thomas Podiatry to see how avoiding these complications only takes a few minutes of your time each day.
Getting a good look at the bottom of your feet is not always easy, but it's important, especially if you have diabetes.
When we have diabetes and we have foot problems, it can turn into significant pathology. Again, it's a large ligament.
Dr. Kevin Thomas with Thomas Podiatry and Associates has seen what the chronic illness can do to the feet.
So for instance, a lot of times we see something called diabetic neuropathy. What that is a foot that doesn't have normal feeling and sensation. So you may step on a rock, a pebble, a piece of glass, you may stub your toe, but not have normal feeling and sensation.
He says without the signals pain sends to our brain, minor issues can turn into a major medical emergency.
So it often goes neglected and unchecked, and it can then turn into an open sore, an infection that we don't realize is there because we don't have a lot of feeling. So this is where we get our unfortunate diabetic foot ulcers, open sores, even limb loss.
That's why eyes on the feet, even fingers, can ward off worrying wounds.
If you realize I don't have feeling, then you need to take extra caution, and every single day, feel the bottom of your feet, check the bottom of your feet. If you can't do it, have someone do it for you. If you need a mirror to look at the bottom, whatever.
If you can't do it successfully, or you're worried about not catching any cuts or other causes for alarm, you can give the job to a professional.
If you can't check it, get to your foot doctor and let them check it. Or get to your family doctor, any practitioner, let someone else check their feet if you can.
The doctors at Thomas Podiatry can do what's called a diabetic foot check.
So a diabetic foot check typically consists of checking the circulation, checking the micro or intricate sensation they have to see how the nerves are working to make sure they have normal sensation, normal feeling. Additionally, we also look for deformities such as hammer toes, bunions, calluses that may create pressure points and could create long-term problems.
In addition to checking the feet for wounds, patients living with diabetes also need to be aware of how diabetic neuropathy can put them in danger of falling.
So a lot of people that do have diabetic neuropathy start to have issues with proprioception, balance, and coordination. And it's usually a progressive loss, so a lot of people don't realize it's happening until they realize that, hey, I'm just uneasy when I walk. I feel like I'm walking on sponges or walking on rubber, and I just feel very unbalanced.
If you do trip or fall, it's important to get seen quickly.
We have some diabetics that have actually broken their foot, and they don't feel it because of the diabetic neuropathy,
creating even more urgency for medical care.
You may bring on the need for surgical intervention because your fracture is not healing. There's many things that can go wrong with diabetic neuropathy.
All preventable with just a little extra heedfulness from your heels to your toes.
And there are more experienced doctors at Thomas Podiatry to check your feet. The team just welcomed Dr. Asma Japper. Dr. Japper brings a whole list of accreditations to the Salisbury office. Originally from Silver Spring, Maryland, Dr. Japper now resides in Salisbury, and in her free time, she enjoys hiking, traveling, biking, swimming, and gardening.